Hi Angela, thank you so much for speaking to us on Medicine in a Nutshell. We're going to be covering the topic of nursing on the ward. Now, you are at present a sister on a surgical ward, is that correct?
That's right.
And previous to that, you would have obviously been a staff nurse and again on a surgical ward.
Yeah.
So I guess you're a brilliant person to be able to tell us a bit about what are the roles and responsibilities of the staff nurse on a surgical ward first, if you don't mind.
Okay. Staff nurse looks after a number of patients. From our point of view on the ward, we have patients that come in acutely or they're elective, so that's planned admissions. And we will look after them, making sure they're comfortable, get them admitted, ready for surgery, looking after them after they've had the surgery and arranging for them to be safely discharged and all the appointments that they need to follow up with.
So the role of the staff nurse is fairly a hub role, as it were,
That's
in
right.
terms of
Yeah.
bringing together care from different aspects. Is that correct?
Yeah, that's right.
So it's not only the medical aspect, you deal with the other bits as well.
We do. We deal with the social side, the mobility, the physical aspect, and it's just to ensure that they go home safely.
And whilst they're in your care, the nurses, I mean, part of the responsibility, I guess, is to highlight any issues. And do you have to interact with the medical team quite a lot?
We do. We work alongside each other just to make sure that everything's in order. We sort of like take control to make sure mainly the paperwork's organised.
And as a sister, now that you've been sister for several years, how has your role changed from being a staff nurse to a sister? Presumably you've got more responsibilities now.
Role as a staff nurse still remains the same as a ward sister, but you take on the added responsibilities of taking some managerial aspects of it, and it's making sure that the ward runs smoothly as you can, making sure the staffing levels are correct, that the stock is correct, and also taking on the added role of being a mentor with taking students under your wing and showing them the role of what they aspire to.
That's fantastic. And on your ward, presumably you get more than just surgical patients, you get medical patients on occasion as well.
We do, yes.
Yeah. So is it reasonable to assume that a nurse on any ward would have to know a bit about surgery as well as medicine, really?
Yes, you do. You're never going to get a ward that just specialises in your particular speciality, but because of the bed crisis of the hospitals nowadays, you'll end up with a mixed bag of other specialities, which helps really because it keeps you up to date with other areas that come along.
So, I mean, I guess patients come in who might have surgical issues, but they will have underlying medical issues, so that's quite helpful from that point of view.
That's right.
Yeah. And could I ask you to become a ward nurse? You go through your nursing training, and then you essentially choose a type of ward nursing that you want to do, and then get into it. Is that right?
Yeah, you do. If there's something that's sort of like a burning desire that you want, then you will just keep an eye on what jobs are available. Applying for them.
And so when you get new nurses coming to you who've just come out of nursing school, for instance, do they have to then do certain courses and such like and get mentored through as well into surgical nursing?
Yeah, ideally as a new staff nurse they have a clinical supervisor or they have supernumerary status, which can last anything between 3 to 6 months, whereby they're taken under the wing of an experienced nurse on the ward, and once that experienced nurse feels the new nurse is competent, then we just let them.
So that's really important, isn't it?
It is,
because because you wouldn't want to come as a fresh new nurse and feel uncomfortable in a scenario.
No.
See, I had not realised that situation exists. That's really good. And do you like being a ward sister?
I do. Yes, I do.
And what component of your job do you like best? I'm putting you on the spot a little bit.
I like the organising part of it, but I still like looking after the patients as well.
It's very interesting. When my dad was a patient, actually, and I remember that he told his nurses elements of his ailment that he never told the doctors, Do you find that the patients confide in the nursing a lot differently, if sometimes more?
Yeah, I think it's more as more relaxing conversation with nurses and patients. Yeah, and when the doctors have been in to review the patients, it's more common that once the doctors have gone, it's the patient will pull you in and what did the doctor say?
and confide in you a bit.
Yeah.
So do you think I mean this video is going mainly out to nurses, but I would hope young doctors watch this. Do you think you would advise young doctors to say, listen to what we nurses have to say about the patient? Do you think that's an important component?
Yes, I do.
Yes, because I think especially senior staff like yourself have a lot to teach our junior doctors, don't they really?
Yeah, they can learn a lot from the nursing staff. All they have to do is ask.
Excellent. Thank you so much for speaking to us. That was really a nice, clear insight into working on the wards as a nurse and then again as a sister. Thank you.
You're welcome.